In this video, we will take a look at what may have happened if Jill makes some choices that contribute to a different outcome. Often when someone has not been informed of the current concussion management strategies, they make different choices immediately after sustaining a concussion or early in the healing process. These may contribute to a higher symptom load and a more prolonged recovery. As a recap about her case, Jill is a 20-year-old student on the women's volleyball team. At a Thursday night practice, she experienced a possible concussive event when her teammate served a volleyball into the back of her head. The team has their first tournament of the season in 9 days and are training extremely hard to do their best. Because of their upcoming tournament, Jill does not want to miss any practice and decides that her symptoms of a headache, dizziness, and a sore neck are not serious and insists that she is totally fine. She returns to play and finishes the last 15 minutes of practice, and by the end, her headache has grown more severe. She returns home and then sits down to study for an exam the following day. She is only able to study for 10 minutes before her headache is almost debilitating, but she attributes that to lack of sleep and decides to go to bed and wake up early to finish studying then, roughly giving her 5 hours of sleep. She had a hard time falling asleep due to her headache and stress about the exam. Jill has a moderate headache and slight dizziness upon waking up Friday morning, and by the time she finishes her exam, she again has a debilitating headache and feels extremely nauseous, as well as having shooting pain in her neck. Jill begins to realize something isn't right and heads to urgent care. At that appointment, Jill is diagnosed with a concussion and is given the recommendation of resting in a quiet room as well as not attending class or practice until her symptoms are completely gone. For the next week, Jill follows these recommendations and stays in her room, not engaging in any activities, napping on and off during the day, and eating infrequently due to ongoing nausea. She is concerned because at the end of the next week, she has had no significant improvement in her headache or nausea symptoms, and her inability to fall asleep at night seems worse. This leads her to reach out to Student Health on campus, which then refers her to the Ryan Center for supervised rehabilitation with the concussion management staff of physical therapists. The physical therapists at the Ryan Center start her on a rehabilitation program focusing on vestibular and cervical impairments that Jill has sustained due to her concussion. Her recovery will likely take longer, and she is beginning to worry about the impact to her grades. Noticing her stress, her physical therapist recommends she reaches out to BU's Office of Disability Services to work with them to grant academic accommodations she may need because of her concussion. In this scenario, Jill makes critical decisions early in the healing process and is given outdated advice. This series of events contribute to what was originally a moderate initial symptom load to become more severe with long-term impacts on her school and sports participation. Had Jill been more conservative in the beginning, immediately stopped practicing, allowed herself to get a good night's sleep that first night, and emailed her professor to request a delayed test date, her symptom load the next day may not have been as significant, and the recovery time frame likely would have been shorter or at least less disruptive to her academic and athletic activities.